The MEC of Health in the Eastern Cape has proposed a temporary ban on funerals. This as mourners continue to ignore the lockdown regulations. A maximum of 50 mourners can lawfully attend funerals. Earlier this week, police uncovered a crime syndicate that has been using fake funeral permits to people wishing to travel from the Western Cape to the Eastern Cape. Joining us now via Skype, MEC Sindiswa Gomba. Good afternoon to you and welcome. So in terms of the clampdown on funerals in the province, MEC, what exactly are you hoping is going to happen?
Well, Jeremy, let me explain the clampdown. It's not necessarily that funerals are forbidden, but rather that we are actually looking them with a different eye. One, that we are now a bit serious in motivating our own people to actually deal with every other dead person or an arrangement as if they're going to be burying a COVID-positive person. And that we're doing precisely because even if a person is COVID positive, our communities still do open the person at home and still do the rituals, which unfortunately is also contributing to the rise in numbers.
MEC, how are you going to enforce this stronger and more stringent approach, given the people in your province in the past haven't been listening to you? They've simply ignored you.
What we have intensified is to work with both the local structures, starting from the traditional leadership, ordinarily because in villages where we're having more of a challenge, is that funerals are always things that are reported at the traditional house in the village. Obviously, for that, we'll have a linkage that this village will be having a funeral. Equally, we've put on board our own councillors in the areas so that they're also part of understanding that something is happening. And when they report that in terms of us and the monitoring structures, it is better then to be monitored because we are now able to know that in this village on a certain day there will be a funeral.
MEC, it's critical that you get cooperation from all stakeholders, but the Eastern Cape House of Traditional Leaders said earlier, and I quote, "Families have a right to give their loved ones a dignified send-off with an abundance of relatives in attendance, along with any rituals required to be performed." It would seem to me that they're not going to play ball on this, that you're on a collision course.
A pity that I can respond to that directly as I don't know the source. However, I would make an example in terms of the Ngadu Great Place that we've been working very closely with. And second, in terms of the provincial house where the Premier himself has been part of it, where we've actually explained the predicament that we are experiencing in terms of such, and that we've been calling of them to also assist in ensuring that numbers are minimized and that the way people do things are not as such. We said maybe this introduces to us a better way and a new way of dealing with how we do things when normal cases.
MEC, are you absolutely convinced, though, that you have the buy-in at this point from the traditional leaders?
I would not stand here and say we have a total buy-in. Precisely these things continue to happen exactly under their watch. To a certain degree, it might be that other people still believe that they can't stand before the family's rituals and everything else. However, as numbers are rising, we're wanting to believe that our own people now have got evidence that because we ignore issues and regulations, these things do happen, and the numbers are rising exactly in their areas.
MEC, I'm wondering whether you don't need to get your own house in order. You'll know that the Minister of Health, Dr. Zweli Mkhize, has said that he's not entirely satisfied with the way in which the situation is being handled in the Nelson Mandela Bay Metro. You'll also know that we have seen a spike of infections in that particular area. Are you doing this properly? Are you managing it optimally?
My view is that it is not only a matter of us not doing it properly. We may be having our own challenges, both in terms of specialization and everything else. However, the fact that communities do not actually assist the process is also making it very difficult. If you go to Port Elizabeth as we speak, you'll find that they are full in malls, they are full everywhere. The other issue is that you will recall that there's lockdown in terms of transport that does not move after 9 o'clock. And when you find those people in shopping areas, it then suggests that they stay in town until transport is opened. And at the same time, because they're waiting, you would not be able to actually enforce the issues of social distance amongst those people. So there are a lot of factors that are involved in what is happening. Let me come back to maybe us as a department. The fact that the minister came to the Eastern Cape afforded us an opportunity of an extra team of specialists does indicate that he wants the area of the Eastern Cape to actually up its game, and that at the end of the day would then be promoting that. My view is that we're sitting now with the team from National and we're starting planning differently in how we're doing issues, because we've got now more specialists who are assisting our people on the ground.
But the argument would be that you perhaps are acting too late. We also know, for instance, that the Department of National Health has been forced to send a Deputy Director General to the province to take the lead in Nelson Mandela Bay with immediate effect. Is that a sign of no confidence in your ability to manage the situation in the city and surrounds?
Allow me to correct that. The person who has been sent to Port Elizabeth as a DDG in Dr. Lita Matuane is not from National. He is part of our employ as the province. I do believe that because that announcement was made, unfortunately, when media was not in the room, their source could not understand well that Dr. Lita Matuane is part of our employ. What has just happened is that he leads the district services and as such has been posted to actually be in Port Elizabeth rather than be at head office. He is not from National, he is from within us.
You've just said to me that the community within the Nelson Mandela Bay Metro also needs to do more, that there are failures as far as the community is concerned. Who exactly, MEC, are you pointing a finger at?
I think I'm pointing fingers at our people. They are still wanting to believe. You remember, if you go back to how HIV and AIDS was actually looked at by our own people, it was seen as a matter that maybe it will not come to me. However, I do believe that that mentality is still there with our own people. And maybe the fact that we are saying it's not airborne, it is about us getting closer to each other, sharing liquids and sharing whatever, it's something that maybe some are still not internalizing. But as we are now looking at issues, if you go right as I speak to shopping malls, you'll find that they're very full in Port Elizabeth. And that is an indication that our people are not observing the regulations.
So, MEC, how then does the provincial administration change that mindset?
Well, we shall continue to talk to our people. We shall continue to engage local structures as we believe you communicate and communicate until people hear you. Our view is that as we get in numbers, as we're dealing with mass screening where we are now, you'll find that if you can go to Port Elizabeth today, in Zwide in particular, they are full. They want to be tested, they want to be screened, because some of them are starting to see that this is really happening.
All right, we're going to leave it there. Thank you via Skype from Port Elizabeth, the MEC of Health in the Eastern Cape, Sindiswa Gomba.